Yep.
Okay.
Yep.
I do see that Todd Oldham is on the call with Bowie.
Yep.
Candace will be able to join us, but if you guys have any specific questions regarding height and occupation, this time is available to answer questions. Okay. Is our audio open? You can. Did you see the email I sent us?
I just saw it. Gotcha. Gotcha.
We have one familiar with the building. I don't know, or our building. The door open, but something's not.
I need to clean this computer up.
Yeah, I need to do that.
Are we open?
Yes, we are.
I'd like to call this meeting of the Virginia Program Healthcare Task Force to order. Joseph, can you please conduct a roll call?
Yes, Delegate Austin,
Present.
Ms. O'Quinn,
Here.
Chair Schottelmeyer.
Here.
Mr. Chair, you have a quorum present.
All right, this time we'd like to open the floor for public comments. Joseph, can you please recognize any members of the public who would like to provide any public comment?
Are there any members of the public who would like to provide public comment?
Seeing none, moving written comments that were submitted ahead of the meeting.
Cody, we had no written comments, correct? We did not. No written comments.
Okay, great. Thank you very much. That will close the public comment period. All right, the first order of business is approval of the January 31st meeting minutes. Is there a motion to approve those minutes?
So moved.
Is there a second?
Second.
Thank you very much. Any comments on those minutes? Seeing none, all in favor? Say aye.
Aye.
Any opposed? Great, thank you very much. All right, the next item on the agenda is the discussion of the board policy recommendation. As before us, for this segment, I would like to recognize Sarah Dunn.
Thank you. Thank you very much. The committee requested that staff develop a policy consistent with the criteria that were described and discussed at the January meeting. And the board policy statement is on the slide. I don't want to read it to you, but the items in bold I think are important. I want to make sure those are kind of founding principles here. It's the policy of the board that per capita funds may be used to support the healthcare industry if a region can provide evidence that a lack of adequate healthcare services is negatively impacting its ability to grow one or more traded sector industry clusters as defined in their growth and diversification plan. And further, the committee discussed that supporting investments in workforce development, that is increasing the pool of qualified workers to support the sector, would be most impactful and again, result in more healthcare services being provided in that community. And so we've developed a policy with that in mind. Next slide. Four eligibility criteria were discussed, and those are the four that are included in the policy before you today. The first is the region must provide evidence that the lack of healthcare services is affecting their ability to grow one or more of the industry clusters. This particular criteria was also recommended by the JLARC report, and so I just like that noted. We will be discussing when we get to the phase of implementation how evidence would best be provided, but that is something that we felt was important to include. The second is that the majority of the participating localities, and this is by population, have been designated as a geographic healthcare professional shortage area by the Health Resources and Services Administration. This is a federal designation, but data collection and analysis is supported by the Virginia Department of Health. I'm going to explain to you how that designation is derived so that we can understand other opportunities to leverage, in many cases, federal resources as well. Item number 3, the efforts focused on expanding the pool of qualified workers. And of course, we, as a Commonwealth, invested heavily in this idea of high demand occupations. And in fact, the Virginia Office of Education Economics has developed a high demand occupation list. Todd Oldham is on the call with us today, so I would just like to recognize him and thank him for contributing to this discussion. And fourth, the region should be able to demonstrate that there is not sufficient capacity to train workers. Again, Go Virginia investments are designed to create new or expanded capacity to train workers, so we certainly would want to build capacity on top of capacity that already exists. Next slide. Just real briefly, the designation of geographic healthcare professional shortage area, and I just want to assure you as members, the board certainly, and members of the public that there is a very effective search tool so that you can determine if you are in a HPSA, an HPSA. So this is not a mysterious, difficult to find designation. There are actually 2 types of health professional shortage areas. One is geographic and the other one looks at subgroups of the population. We are selecting geographic because it certainly aligns with our geographic focus. And it indicates there's a shortage of providers for an entire group of people. It does have 3 sub-designations, if you will: primary care, mental health, or dental care. We recommend that all be considered in evaluating eligibility. But I do want it noted here, the primary factor used is the ratio of health professionals to the population, okay? And the agency has established what they believe are appropriate ratios. Whether or not they're appropriate is probably up for discussion, but they are universally applied ratios, and I think that makes it a very objective criteria.
Kind of a couple questions on that with the ratios. Is it by subgroup? Does it say number of primary care physicians to the population, mental health, dental care, or is it the aggregate, or is it by subgroup?
It's by
subgroup?
By profession.
So by subgroup, yeah.
Yes.
So the number of primary care, the population, number of mental health, I would see behavioral health is actually a broader term.
Yes,
To the population, and dental care to the population.
that's correct.
Okay, it does not include specialists or subspecialists or anything.
It does not. Okay. And then further, as I mentioned, it does provide alignment with the NHSC programs, and I think Todd, you alluded to this at our last meeting that, for example, these programs offer scholarships and loan repayment programs for physicians that locate in health profession shortage areas. So as Go Virginia aspires to build capacity to train workers, there are also mechanisms to encourage the attraction of healthcare providers as well.
There's one other question just on the grouping, like primary care, does that just include physicians, or would it also include physicians assistants? Dental care, does that include just dentists and DDS, or does that also include dental assistants, technicians, and people like that?
Right. So on the primary care, I believe PAs are included as a primary care type. On the dental care, it probably does not include, and I want to be very careful answering this question. I don't see Anna Reagan on the call, but it does not include, for example, dental assistants, but it would include orthodontics as a specialty area, for example.
But there are clear definitions of what's included in primary care, behavioral health, mental health, and dental care.
Absolutely. Absolutely. Next slide. Just briefly on the high demand occupation list, and they have a very nicely built website where regions can go and better understand high demand occupations, and there are a number of other dashboards and tools. This is just one small product that Bowie has developed for the Commonwealth. I put in parens Bowie Career Clusters Health Science because it is a search tool that allows you to look at a lot of different career clusters. Health science is the one applicable for the healthcare industry, but they similarly have other career clusters in manufacturing, for example, information technology, but health science, and just to be specific. The criteria used to develop the high demand occupation list are published in the PDF version of the document, and I've summarized them here. Todd, I'm going to ask if I get it wrong, let me know immediately. But minimum annual wage at 50th percentile of occupational earnings. And so $29,160 single adult, which is the equivalent of 200% of the federal poverty level. The typical entry-level education range for occupations on the list range from no formal education up to bachelor's degree. There is also a threshold for demand, meaning average annual openings, and they have created a threshold of a minimum of 100 openings statewide. There's also a growth threshold, if you will, which is 1% growth over a 5-year projection period. And then they also included occupations that had qualified registered apprenticeship activity, meaning employers across Virginia had 10 or more active registered apprentices. And that's just an indication that employers are looking for those kind of quality work-based learning opportunities. And again, apprenticeship or paid learning opportunities, they're typically accompanied by very structured related instruction in a classroom. So in terms of next steps and implementation, staff recommends the policy go into effect 30 days after enactment. And this is why we'd like to design a couple steps to engage area stakeholders and make sure that any administrative guidance that we develop addresses fully any questions related to the policy. We would like to conduct some small stakeholder engagement sessions. Again, just so we can think through various scenarios that might present before the policy go into effect. We will need to develop some very simple administrative guidance, and we do have program guidelines that we need to amend as well. We recommend using our regular application and just develop a very small supplement that will speak to the 4 criteria that are included in the policy. For example, please provide evidence. Please indicate if the majority of the populations being served are HIPSAs. Please indicate, for example, the occupations you'd like to target with this initiative, and please indicate why you feel or why you do not have adequate capacity to train workers in these categories. So to collect responses to those 4 questions. And we'd also like to provide a little bit of technical assistance and training, just so folks become kind of familiar with this particular policy and its implementation.
Would you want to go back 3 slides, just the eligibility slide? You didn't know because I was supposed to have it.
No, sir.
Right here. So this would establish eligibility only for the jailer recommendation. Projects would still have to be considered on the merits for the project outlines that we have. But this would effectively establish eligibility. The first one would focus on staying true to our industry traded clusters, right? And this is really that we have to have healthcare support the growth of those industry clusters. And the second one is obviously a second where we're defining the need empirically, so empirical third-party validation and data. And then the last one, we can focus on capacity. So very consistent in terms of establishing eligibility, and then each project would have to be reviewed on the merits of whether or not the project eligibility would have been established already before you get there and you do the project based on the project criteria. Right.
Exactly. So the policy further speaks to kind of outcomes. So for a talent development or workforce development projects, there are some core performance measures and general framework for Go Virginia program investments. We think those could be applied consistently and in accordance with our existing policies for the healthcare sector, these eligibility criteria on that.
Did we, and this may be part of the follow-up, did we map based on this again? This is the right way to do it, establish the criteria first. Did we map which regions would be eligible based on current data and which occupational areas would be eligible based on current data?
Yes, so I have looked with VDH at a map of the HIPSA areas currently, and I believe they're reevaluated every 2 years. So that also makes sure that there's some currency to the information. It is, as I think we all would expect, certainly rural areas are much more prominent and designated as HIPSAs than some of our more urbanized areas, which I think will be illustrative to the whole effort. So in terms of the high demand occupation list in the health science area, it is quite varied. I mean, what I appreciate about the list is there are lots of career opportunities accessible to a wide variety of individuals, for example, and I think it represents what the healthcare system, both hospitals and support staff at physician's office and other type of practice areas would need. And the high demand occupation list is updated annually as well. It is not currently mapped to Go Virginia regions. It is mapped currently to workforce boards, which are a slightly different geography, but I don't think it would impede the utilization of this list for this purpose. And I don't want to pop this on Todd, right? He's live on camera here, but they have developed some other lists using Go Virginia regional boundaries.
So we didn't adapt that.
Absolutely.
All right, questions by the subcommittee, comments, or Delegate Austin?
I like how clear this is, because I think it directly addresses the conversation from the prior board meeting where this came up. And so this gives a clear roadmap for what will be considered acceptable consideration and what will not. And so I think that's, there's been a lot of good work to dig into what we could use, and thankfully there's a lot of good data that I like the clarity of it, and I like this addresses the concern to help those regions that need it get over the hurdle of being able to use healthcare to get to some of these other treatment centers.
I also had a conversation with Secretary Slater, very casual conversation at the Patrick Henry building, but I spoke to him a bit about the high demand occupation list, which is a list that's being referenced for a variety of other purposes as well. So to the degree a shared target, if you will, would help us leverage other resources, including federal resources, to support what's called individual training accounts, for example. The high demand occupation list has a lot of crossover and reference tools to understand how other state investments to support tuition for students is available by occupation. So it's nicely done, and I think, you know, will be helpful for all of us to focus resources in this area.
Delegate Austin, questions, comments, feedback?
Mr. Chairman, thank you. I like the eligibility criteria. I think it's very well put together. I think it's something that we've needed in the past on the Go Virginia criteria, and I think it's easy to support, and I think it'll be in high demand throughout the Commonwealth. Healthcare needs are in such a high demand that we should be playing in this arena. So I like the policy, Mr. Chairman.
And I really like this clear up on this supports our principal focus on industry clusters, trade sectors. But you can't get to that if you don't have certain resources and capabilities in place within healthcare.
Right.
And one is predicated on the other. You can't have a conversation about some of those industry clusters without having adequate healthcare resources. And where that doesn't exist, it becomes a predicate, frankly, to be able to do what we want to do from a trade sector standpoint.
Could I ask the committee's opinion on item number 1? And again, that was a recommendation in the JLARC report, which the committee agreed was worthwhile to carry forward. This issue of providing evidence Has there been any thought to what would be adequate evidence? I've got some ideas myself, but I'd love to hear yours as well.
I think it might be individualized to each of the different areas, given the current challenges, but I would personally think that that should be a broad scope of both anecdotal, but also if there is, if you try to pursue a project and hit a roadblock in terms of you don't see that the healthcare industry is robust as it should be. But I do think it'll be individualized. I don't know that there's really a good prescription for a one size fits all on that.
I would agree. I think we also have to give some trust. We have the regional councils in place for a reason.
Absolutely.
They develop plans. We delegate a lot to them. They know best what's happening on the ground in their region and in their area in terms of economic development, diversification, and the resources that are needed to support the development of those traded sectors.
Mm-hmm.
So I think, asking them to make sure that attestation, not a legal attestation, but as part of the growth and diversification plan, they identify that as a real need. And I think there's probably some empirical data that will support that. Support.
Yeah. Yeah, that's what we were thinking as well. Really a very, I could envision, letters from area employers, for example, commentary or examples from economic development practitioners in the region that speak to this point. So yeah, I agree. I think it's going to be very varied, and I would recommend that we be providing evidence to be a bit more flexible, and I don't want to say subjective because everybody wants to know, are we going to get through the gate here? But I think there's got to be, the demonstration that that item number one is in fact true. And
I think almost by, Delegate Austin, but I think almost by definition, 0.2 and 3, 0.2 to some extent provides that evidence. If you're named a particular designation because there's a lack of resources, to me, that's almost evidence of that.
Yeah.
Need, because I think we all agree and understand that you can't have robust economic development unless you have healthcare, strong healthcare laws. Businesses won't move there. Businesses won't stay. Workers won't stay. So I think points 2 and 3, the measurements, the external measurements here will reinforce, I think, the evidence at a regional level that supports that.
That's right.
And that's my opinion.
Yep.
Delegate Austin, anything on that? Anything to Sarah's question on that?
No, I think I agree with everything said. I think, we have to determine, it says provide evidence, of some criteria for what we accept as evidence as the need arises. But it's clearly obvious, the demands are there. Secretary Slater's involvement and participation in this is very important also. So I think we've pretty much covered the basis. Sarah's done a good job in the committee. So I think I'm fine with everything put forth as it is.
I agree with this. Just the comment about every region's a little different. Every region has a different needs. That's one of the great things about the Commonwealth. Different places.
Yeah. Okay. Fantastic. Thank you for that feedback. And is there any objection to the suggestion that we allow, I'll call it a delayed enactment clause of 30 days to go through some of those items?
No, I think that engagement's good and healthy, getting additional feedback and also clarification.
Yep.
Support, I think that makes sense. Okay, any other questions or comments on this for Sarah? Okay, so what we'd like to do is we'd like to move this in advanced policy recommendation number 17 to the full board for approval, correct?
That's correct.
All right, so it's okay. I'm going to move that. We move to advanced policy number 17 to the full board for approval. Is there a second?
Second.
All right, any discussion, further discussion? All right, all in favor, please indicate by saying aye.
Aye.
Any opposed?
Aye.
Okay. All right, great. Motion passes. All right, is there any new business before this Gus committee? Let me just say before we conclude, I really appreciate the work, Sarah, that was done by you and your team, and Emily for your participation, and Terry as well for your participation too, because I think we did a lot of good work. I think we listened to the feedback, both at the meeting in September and the feedback from JLR. I think it's important to establish eligibility criteria so that applicants are clear if they're eligible or not before they ever get there. And we ultimately decide on the project based on criteria for establishing that eligibility makes Yeah, that makes sense. So thank you all very much for the
Thank you.
work.
Support you in this decision.
Okay, with that, we're adjourned.
Thank you very
all
much. Thank you. And just for, please go ahead.
Thank you, Mr. Chairman.
Okay.
And for members of the public, I just want to remind you, we are going to transition into another committee meeting, but there is a separate link for that meeting. So we're going to be closing this meeting and reopening another in advance. Thank you.
Great.